How many of you out there can't activate your glutes and hamstrings? There's an easy exercise for you next. Hi Revivers, I'm Dr. Lin of Rehab and Revive. A lot of our activities require our hamstrings and our glutes. We need it for walking, we need it for all our daily tasks, and we need it to sit up. So I've got this exercise that's going to help you. Stay tuned. Here's the setup for this hip extension exercise. Prolonged hold is what I call it. So what we want is a yoga belt. If you don't have one, it's okay. Use like a towel, like a beach towel if you have one, or just your regular belt. And then what we're gonna do is we're gonna lie on our backs and we're gonna hook this underneath our thighs. All right, put it right underneath your, kind of the crease of your knee. Probably easier if you're here, if you find it hard, but here is the best, is what I found. The goal, hold tight, push down, and you're gonna hold this until the shakiness stops. You should feel this muscle engage. This one, disengage. If you prefer to have your knees up, it's okay. You can lay it down. What I really like is that the whole goal is to push down and in an arc-like manner towards the table. Like I'm trying to stomp a bug right here. So I'm just trying to hold it right here and I'm pulling up with my might. And then I'm gonna have to go through some shakiness. I'm exaggerating the shakiness, but trying to activate this muscle is really difficult. So what you want to do is just hold it, and your job is just to hold it until the shakiness stops. And I'm shaking a little bit, so that means it's not engaged. The integrity of that connection, that neuromuscular connection isn't there. So now, okay, now I'm starting to shake more. So I'm trying to wake this guy up, and you kind of see that. And then once it becomes solid, your exercise is done. As you get better at this, you could try different ranges. So let's try here. Just because I'm stronger here doesn't mean I'm stronger here. So this side, actually it's okay for me here. So, you know, just try the different ranges and you can play with that. But make sure you hold it until the shakiness stops. That's the goal. So how many of you shook and had to go through the shakiness for a long time? It takes some time, so give it a little bit of commitment and don't give up. I think that's the most important thing to know about this hip extension exercise that I created. If you like what we're doing, make sure you subscribe below and leave any comments, or you can always email us at rehabandrevivemedia@gmail.com. I'm Dr. Lin. Remember, we can and we will get better together.